Hi, my name's Tristan Wheeler. Today, it's all about Canadian healthcare. I decided to change it up a little bit. I got rid of the blue sheet behind me so you could actually see the room I work in. Makes things a little more personable, and I don't have this blowy blue thing that I constantly almost pull out of the ceiling all the time. After having a few discussions with American friends regarding the Canadian healthcare system, I thought I'd do a quick synopsis so I can stop having to explain it over and over and over again. Before I have any right-wing mouthpieces jump all over me, any statistics I use are provided either by A, academic studies, or B, the governments that I'm discussing, be they either through the American Census Bureau or Statistics Canada. So just leave me alone. I'm spouting off statistics that I have researched, and it's not just me saying Canadian healthcare is better than American healthcare. So shut it. Most healthcare in Canada, except for hospitals and certain medical facilities, is provided by private enterprises or private corporations. This means that doctors are not in the employ of the government. This is a very, very important distinction. In places like the UK, they are actually paid by the government. In Canada, they are private practices. The whole part of our healthcare system is that your health insurance is provided by the government of the province in which you reside. It's funded primarily through income taxes. There's some things it doesn't cover, such as prescription drugs, although drug prices in Canada are negotiated by the federal government with the drug companies to keep costs under control. So in Canada, a drug will cost you a lot of money, but in the States, because there's no real price controls over a lot of drugs, getting something like an anti-cancer drug can bankrupt you. The other things it doesn't cover are non-emergency dental care and cosmetic surgery that's non-reconstructive. That's very important. They will cover reconstructive cosmetic surgery, but not non-reconstructive cosmetic surgery. Basically, it boils down to this. Except for hospitals, healthcare in Canada is provided privately and funded publicly. Even though health insurance in Canada is publicly funded, it still costs the government less per capita than the U.S. In 2008, it cost the government of Canada $4,079 per capita, and in the States at the same time, the cost per capita was $7,500. Since there are no market forces in the Canadian healthcare system, the difference is actually in the philosophy of care. In Canada, we tend to focus more on preventative care, so minor things don't become major ones and hospitalize somebody because somebody can simply go to the doctor, present their health card, and that's the end of it. The doctor sees them, gives them a prescription for antibiotics, and they're done. In the States, it tends to be more focused on outpatient care, which actually ends up being a little more expensive. Outpatient care being things like day surgery, seeing specialists, things like that, after something has become a major problem. One interesting thing to note is even though Canada has less spending per capita, the average life expectancy in Canada is actually higher than the States, with a Canadian living on average 80.7 years versus in the United States 78.2 years. Again, this has to do with more of the whole preventative care. The Canadian government does spend more per capita on older people than younger people, but it's still more expensive in the States. You see, that's one of the best things about the Canadian healthcare system. Young, old, terminal illness, emergencies, just a checkup. It will always be there. If you live in Canada and you need health care, they will never turn you away because you don't have private health insurance. You just got to smile, show up with your provincial health card, give it to them, and you just got to wait your turn. It's by no means perfect, and there are some things that we do have to work on in Canada. Wait times tend to be a little longer, but the system does work, and you don't have to worry about, I don't have private insurance, so the hospital's not going to take me. Thanks for watching. Now I don't have to explain it every damn time somebody asks. I'll see you guys either this weekend or a little bit earlier next week. Talk to you later. Have a good night.